All right, good morning, everybody. Welcome to another episode of Black Mental Health Matters. My name is Trinity Thompson. I'm hosting today, and I have two very special guests with me. Today, we're going to be talking about chronic illnesses and its impact on mental health. So, I have my two guests, and I will let them introduce themselves.
Hey, hi everyone. My name is Ananda Palmore, sickle cell advocate. I was born with sickle cell. And yeah, I'm currently based in Atlanta, Georgia, but located in Las Vegas. And I'm so excited to be here.
Hi everyone, my name is Imani Jackson. I am a sickle cell advocate, also born with sickle cell disease, SS specifically. I was raised in Long Island, New York, but I currently reside in Atlanta, Georgia, and I am a graduate of Spelman College with my biology degree.
All right, yes, very important. These are my Spelman sisters here. We all graduated in 2021, and I'm just really excited to have this conversation today. So, the first question that I really want to ask, just for a clarification for our viewers that might not know what sickle cell is, what is sickle cell? What does it do, like physiologically? How does it kind of like present itself?
So sickle cell disease is a missense mutation. Like I'm gonna biology wise, it's a missense mutation. So when your genes are copying itself to create the human you are, it was just an error almost in the copy machine that
Okay.
caused the sickle cell trait. How you get full blown sickle cell disease is you have to have two parents that have the trait, and then you have a 1 in 4 chance of your child having sickle cell disease. Now, a lot of people think when you're having children, that means that each child will specifically get a 25% chance, which really means like out of 4 children, one is going to have it for sure. So that's actually how it manifests. And then there are different types of sickle cell disease. So obviously, there's the trait, which research is still out there that detects whether that will display symptoms, but it is sickle cell disease, which is considered SS, and then there's sickle cell disease SC. Then there's sickle cell alpha and sickle cell beta, which have been shown to have like less displays of symptoms such as hospitalization, crisis, fatigue. It has less of that. It really still shows up on like blood tests and stuff. But then there's SS and SC, which are more symptomatic, and how that I want to say manifests itself. Like I'll guess I'll let Ananda talk about that.
Yeah, I mean, sickle cell, they always say, like, they describe sickle cell like a snowflake, right? Like, you can have, anyone can have different types of sickle cell, right? But also, two people can have the same sort of sickle cell, and it just manifests differently for everybody. Obviously, what many people may know that it's terrible pain, really, really, really bad pain. But the pain can happen literally anywhere, the legs, the back, the arms, this everywhere. Your spleen enlarges, like I've heard some people have a sickle cell crisis behind their eyes, So, just as your blood cells, are all throughout the body, sickle cell impacts wherever your blood cells are. And so it can go beyond pain as well. That also includes, the emotional and mental depression as well, which is why we're here today.
Okay. Yeah, and I think it's important to note that even though these two ladies have sickle cell disease, um, it's not that we're making the comparison to from sickle cell to other chronic illnesses, but it's really about to like just highlighting the fact that people with chronic illnesses that go through these things on a day-to-day basis do experience some mental wear and tear. So I feel like that's really important to note. And we're just gonna go ahead and get straight into it. So the first question that I have, well, the second is when were you diagnosed? And do you remember like how it felt? How did you feel? What were some like signs that you might want to get tested?
Okay. So for me, I was diagnosed when I was 6 months old. So I don't really, obviously remember what that was like. I could only imagine what it may have been like for my parents, where their 6 month old baby to have their first crisis. I don't think that, and I'm not about to say back in the day, but I don't think that they were testing like that. I'm not
Mhm.
sure. But I know that from what they said, my first symptoms were jaundice. And there were just moments where I would just be crying. So I guess I was in a crisis. And that's when they finally, realized and the doctors finally diagnosed me with sickle cell.
Um, so I was diagnosed at 3 months old because actually the year 1999, I think that's when we were all born here. Um, that's when they came out with newborn screening. So, I was tested and found out that I had sickle cell disease. Obviously, at 3 months old, I cannot recall what having sickle cell was like then. But a lot of my symptoms started manifesting around 2 years old. I had my first acute crisis, like strong, it was called acute chest. And I was hospitalized for like, I want to say a month. And so obviously, I don't know, there are memories of like my early childhood having really bad crisis, but I want to be able to like bring you to the specific scenario of how I felt emotionally and mentally. I think just sometimes even the fact that thinking back on my memories as a youth, a lot of it is encompassing of me just being in the hospital, me being sick, me being like left out of a lot of childhood activities is what is like a big toll, I think, when I think back on like my memories and people are like, remember the silly band trend? And I'm like, no. Like I don't. So yeah.
That definitely like just makes me think about chronic illnesses that manifest in earlier years or things that like you're born with versus when
Mhm.
people develop illnesses through like later on in life. So like maybe cancer might be how cancer is more prevalent or different types of cancer are more prevalent in check later on in life, like prostate cancer, breast cancer, those types of things that people have to they know that they've been living their life healthy or they feel like they've been living their life as healthy as they could this entire time, and then they kind of have to like flip that switch of now I'm sick. Now, like, this is something that is new to me. I've never lived this lifestyle versus somebody that has a disease like sickle cell, where it's like, this is all that I know. This I grew up with this. I was diagnosed with at an early age. This is all that I know. So I was definitely gonna ask about like how did you feel like this like emotionally impacted your childhood? Like, did you ever feel left out? Did you ever feel like excluded from family, isolated at school? Like, just talk a little bit more about that.
You're on mute, Imani.
Sorry. So I said, um, I personally think that when you're younger, it really depends on how I want to say you see yourself around the people like around you and where you think you fit in general. So I think for a long time when I was younger, I didn't think it was weird to be around a lot of adults. Like when my siblings, because I'm the youngest of five, were outside playing and I was like in the house watching TV, I'm like, yeah, it's hot. I don't know why they want to be outside. But in all actuality, like there was an age where it hit where I realized like, no, it's not that. I was choosing to be like excluded, choosing to be like outside the pool versus in the pool, like choosing to be inside the house versus outside the house. I think it was more so of decisions being made to help me stay out of the hospital. But even then, like I had really bad case of sickle cell between I want to say like elementary school and eighth grade, where I was hospitalized at least 65% of the year to the point like a tutor would push into the hospital and like teach me my coursework while I was younger. And I think I just have memories of people always being like, 1 minute, like I said, 1 minute you're at school and everything's cool and you're listening to like the new trends, and then you come back and life has changed. Like, oh, okay, we're not on MySpace no more. Now we're on Instagram. Like, oh, now we're on this. Like, that's what I think of when I think of my childhood, is just mentally and feeling left out, like left behind a lot. And I think it didn't really take a toll on me because I was okay with sometimes like going my own way. I think that's just my personality, but it does make you feel like emotionally like, dang, will there ever be a time where like I feel like I can currently relate to people, or like, even talking about stuff like drama with your friends? It's like, yeah, because my doctor's trying to get me to go on this new medication, and I'm like, I don't want to be a guinea pig. And your friend's like, yeah, like I can't relate to that. And I think so it's just like emotionally feeling like nobody really can see you and relate to you a lot. I think that's how I felt growing up.
Yeah. All of that, I feel like for me, especially I think for me it changed. So like as I went from being a young child to my teenage years, obviously I felt very different about my sickle cell. But for me, I feel like as a young child, I feel like I always did everything that I like wanted to do in a way in which like I would go out and play, and I would, do different sports and things of that nature. But I feel like I wasn't really as cognizant of my sickle cell because I was so young. So yeah, I would be, even though I wasn't supposed to, I would go and jump in a pool of water. But then I would go into a crisis. You know what I'm saying? And then, I'll have a conversation with my dad, and my dad would be like, well, how did this happen? And so when you go into a crisis enough times and you really realize, that's when I really started to realize, like, I can't do what everyone else can do. But it really was it when it comes to those moments, or even when I'd be in PE, like the teacher would kind of treat me differently and say like I didn't have to run the whole time,
Mhm.
or and then like just being younger and being in class, people. I grew up in Las Vegas as well, so I didn't really grow up around a lot of people who had sickle cell. And so that was an added layer of just isolation as well. And so even like those moments, like Imani said, like being in the hospital and then having to catch up on my schoolwork, or, there was a moment where I couldn't, like maybe like second grade, I couldn't walk for a few months. And so I was in the hospital for a few months and teachers coming in. So it's like those moments, those little moments would always remind me that I'm different. But outside of that, I kind of just lived my life as normal as I possibly could. But there were moments of not only isolation, but just alienation, because
Mhm.
people just didn't understand sickle cell, especially where I grew up. So oftentimes I did kind of feel like an alien almost.
Yeah.
I'm
I
sorry, I
remember.
would like to add,
Okay.
I'm sorry, that I think in my childhood, though, what something that made me feel like amazing was sickle cell camp. I know that sounds crazy because when I tell people that, like, I guess don't have sickle cell, they're like, there's a camp full of people that just have sickle cell. And it's like, well, yeah. And I think that made me feel very seen, very understood. Like at breakfast, when everybody's taking their medicine, it's like, oh, okay, girl, what medicine are you on? And it's like, okay, maybe I'm normal. Maybe there is a group of people that yeah. So I think that is one thing, like Ananda said, like it didn't really stunt me being a child. It just was like my childhood looked different.
Yeah, exactly.
I think that like is I remember when you told me about sickle cell camp. But I also feel like just like hearing you talk about it again, like it's definitely is important to like add structures that include especially children with like disabilities to make them feel that they're in an environment where they are understood. And I do remember like our first encounter like with one another was when before freshman year had started and I found out that you were going to be my roommate and I had texted you. I texted you and your mom had responded and told me that you were in the hospital because at first when you didn't respond I thought you hated me. You didn't like me. But I think that you were definitely kind of like my first like close encounter with somebody with a chronic illness. And the first year that like we had lived together, that we were roommates, like I learned so much like from you and the things that you go through, and like just really taking advantage of the times when you were feeling up, because it's like Imani's up, like we're getting to it. We're moving and shaking, shaking and moving. But the times when you were down, it's just like I don't know too much about this disease to figure out like how can I help? Like what is the best way that I can support? And then in 2018, my mom was diagnosed with multiple sclerosis. So again, that was just kind of like another person that was close to me that had a chronic illness. And it's just about like for people that are close to people with chronic illnesses, it really is just kind of like a life shift. And like I don't ever want to like make anybody feel like they stand out because of this by like saying like, hey, are you okay to do this? And so I would imagine like how maybe you've gone out into the world and people, just like Ananda said, people that treat you differently because like what you have, like, oh, you don't have to do this activity, you don't have to exert yourself that much, when it's something that you actually feel like you can take on, but they deny you that opportunity. They make that judgment for you as opposed to you making it yourself. So that kind of leads me into, how does sickle cell impact you within your adulthood, like physically and mentally?
Do you want to go? Okay. I feel like into my adulthood. So I feel like for me, I didn't really meet people with sickle cell until I went to Spelman, until I came to Atlanta. And so I mentioned that because I feel like for me, meeting people, and sharing those similar experiences, that's when I kind of gained a sense of normalcy when it came to living with a chronic illness, because I just wasn't as isolated and as alone. And so leading into my adulthood, having that support system has really it's really made an impact on me mentally and emotionally when it comes to having sickle cell, because I don't feel so much like an alien as I did before. But it's just one of those things. Like I feel like I've finally reached the maturity in which I understand that there are certain things that I maybe would want to try to avoid. But I also try not to limit myself as well. And I feel like, just growing up, it's like, we've kind of grown up with sickle cell, and we've grown up with like our type of sickle cell, right? So just growing up with the chronic illness, I've been able to identify my triggers more. I've been able to identify, even like, okay, how bad is it really going to get? Should I take a little medicine right now? Like, how can I've been able to manage it a lot better, and even maybe even prevent it as much as I can a lot better.
Mm-hmm.
But I still have my times, like my moments, like homecoming. Y'all know homecoming. Homecoming is
Shout
like,
out Homecoming.
girl, homecoming is
Shout
like,
out Spelman. I'm so sorry. Spelman's in the house.
someone's in the house, spell house. Like, if you've been to a spell house homecoming, but for me, it's my kryptonite. Like, I literally have to balance being outside but also you have a chronic illness. And I will say mentally and emotionally, it does get very frustrating, because oftentimes I'm like, why can't I just be young and turn? Like, why can't I just be, and just live my life and not have to worry? And there's even moments of like, I wouldn't say jealousy, but just like I envy those who, can take their health for granted, because I know that I can't. So I say all that to say it's levels, you know what I mean? But I feel like now that I have a support system, like people like Imani and other people who I know who have sickle cell, and just those resources, it's definitely gotten better on my mental health for sure as an adult.
So yeah, similar to what Ananda was saying, I think for me personally, and I'm glad that like Ananda opened up with like the snowflake reference of how like sickle cell will manifest itself differently in everybody, because I know for me, I don't want to say around Hoko time, I'm a little favored, but I ain't never gone in the hospital during HOCO.
Wow.
You know what I'm saying? Like,
But yes,
What about
but,
you?
but I do know that around homecoming, and on a serious note, it's not just homecoming, but a lot of people, like, that's the time where the hospital is actually more packed with sickle cell patients because of the weather change. And that is a trigger for a majority of people who have sickle cell is weather change. And weather change, because like it affects how your cells literally go through your vessels, like how constricted they feel. And a sickle cell crisis is essentially a blood clot anywhere in your body, because like our blood cells are shaped differently. Like a percentage of our cells are not circular, they're crescent shaped, hence the name sickle, like sickle cell. But it's literally the time where people are in the hospital. So I know I have, if I were to do like a data chart of when I went into the hospital, it will fall around the same time every year. If I had a perfect year, like when I mean hydrated, I'm outside, nothing stopping me, I would still go into the hospital around the same time of year, simply because my body just like, oh, it's fall. Like, I don't know. I feel like groundhog season, but like my body. Like, it's like, oh, it popped its head out. Now you're going in the hospital. Like, so I think that for me, transitioning into adulthood, I found so much more joy being able to navigate my disease without a whole bunch of opinion. I think that is one thing that I truly enjoyed, because when you're younger and you have a chronic disease, I think a lot of decisions are made for you. And my mom was really good at helping me transition into my own level of advocacy. So, knowing when to communicate with professors, peers, friends about what my chronic disease is and what it looks like and how that manifests in that specific relationship. So, being like, yeah, girl, I want to go out with you, but it's not going to work for me, because I just know that this is the type of event where I could be triggered. And unless you're going to go to work for me, unless you're going to go to class for me, I'm sorry, I can't do it. And I think it's like that honesty with the people around you that make you feel more human and connected to them, even when like they don't like experience the same things you're experiencing. So like physically, I enjoyed like transitioning to adulthood, because I think I was able to be like, I don't want to take that medicine, and I want to do this with my body, and I want to, I may want to be young and turn and then deal with the consequences later, you know? But what I would say is around like the age of like 20, 21 is when my sickle cell, and most it happens to most people, is where your sickle cell like almost like matures, like it goes through puberty, and you kind of get your second wind of how your body is changing.
Yeah.
So it's like, while you thought you just had mastered your triggers, it's like, oh, actually there's new more, like the Inside Out movie, like, oh nope, new emotions. So it's like new triggers, and a lot of those triggers actually deal with your mental health rather than physical things outside. So while when I was younger, it was just like cold weather is a trigger. Now that I'm older, it's like anxiety is a trigger.
Yeah.
When I was younger, and it was just like maybe me being dehydrated was a trigger. Now that I'm older, it's like triggers can form from me just being like too stressed out or going into depression and not taking care of myself as much as I should. So like I go into a depressive episode possibly, and now I'm not taking my medicine as consistently, and now I'm not reaching out to my support system as much, and those things kind of accumulate, and now I'm in the hospital for 2 weeks and 3 weeks. So I think while the physical can get a little bit more, like it's easier to navigate, sometimes that emotional aspect comes in, and you realize that it is tough to feel like, dang, I can't really do what everybody else is doing. And I think one of my first like sessions where I ever went to therapy, and I started therapy around like a year and a half ago, my therapist, the first session, she goes, "You can't do what everybody else is doing." And I'm like, dang, like, all right, not too much on me.
Mhm.
Like, because when you're younger, a lot of the narrative is like, no, if you just take your medicine or if you just stay hydrated, you can still be the same. And my therapist was like, honey bunster, you'll never be the same. Like, you'll just never be the same. But that doesn't make you lesser than. Like, that just means that you have your own journey, you have your own walk, and you can still maybe do the same things, but it's just not going to look like the person next to you. And so I get what Ananda was saying with a little bit of like that envy, because it's like, dang, like I want to be able to just sometimes be a little reckless and not care about my health. Or, if somebody is sneezing and it's like, oh, okay, like they're sneezing, God bless you. But somebody sneezed, now I gotta go pop a little Zyrtec. Like I gotta go pop something because my immune system is so low that next thing you know, I'll be sneezing and I'll be sick for weeks. And then me being sick with just a common cold can trigger my sickle cell. So it's just like
Yeah.
navigating yourself. Yeah.
Oh, I'm glad that you brought up like how some now that you're older that anxiety and depression do kind of like can trigger a cell crisis because I did my research. And one of the things that I read from the American Association of Hematology is that depression and anxiety can actually be correlated with the pain related, the severity of the pain, as opposed to like the biological counterparts, um, when having a sickle cell crisis. So I think it's really important to, just like how you said that your body goes through like a second like maturity, like physiologically, but your sickle cell as well, or any chronic disease, it can be a little bit more severe or it could be like a little bit more mild, just kind of depending on how you're able to take care of yourself and the way that it manifests itself. Definitely is important to kind of like keep track of patterns, especially as you get older. Like, I don't have a chronic illness outside of asthma, which is not like severe for me, but I know that people that do have like severe asthma, they have to keep pretty much their pump on their hip. Like they have to be with it at all times or else they're not going to be able to breathe. Same thing with people with either type 1 or type 2 diabetes. They need to be with insulin at any given moment, be able to check their blood sugar, because with it going too low or too high, that can definitely be catastrophic. And it pretty much plays into like, well, what am I able to eat? What am I able to consume? How's my body going to react to it? Which can also trigger, dang, like I really want to go to this new fried chicken place. They have great fries, but I can't take in that amount of like those amount of carbs. And I feel like, food is very important, like within our community, the Black community is very important. So like once you feel like I'm limited to what I can eat, it's like there's no point. Not that there's no point, but that's something that is culturally important to us. And you being told that you can't eat the way that you have been eating is definitely like a lifestyle change. And I have diabetes, that runs through my family as well. So Imani, you talked a little bit about therapy. Would you recommend other people with not just sickle cell but chronic illnesses in general? Would you recommend therapy, some sort of counseling, support group, whatever? Would you recommend, both of you, would you recommend that to somebody else?
Of course. Like I think in general, sometimes we use the word adults so loosely. Like you just went from having certain things catered to you, certain knowledge given to you, certain ways of navigating things told to you, and then you turn a certain age and everybody's like, oh, you should get it yourself. And I think that just comes with a lot of pressures, regardless of having a chronic illness. And I think when you add a chronic illness on top of that, you are setting yourself up to kind of increase your own anxiety, increase your own like depressive episodes, because you will feel not only overwhelmed, but then your body will start reacting to that. And for me personally, and I don't mind sharing, but I never thought I was someone who had like bad anxiety or like anxiety in general, but like I actually ended up being prescribed medicine for my anxiety. Like that's how bad it was. And I think that it does help with me not only like navigating adulthood, but also being able to navigate my chronic disease more, because I'm not now going down a rabbit hole when I'm about to get sick. Like I'm like, dang, what if I go in the hospital? And then if I go in the hospital, how long am I going to be out of work? And then how long am I going to be out of work? And how is that? I'm sorry, that was my rabbits. And so how is that going to affect my income? And then how is my income going to affect, me being young and wanting to go out and do stuff? So it is just like you can just have like a snowball effect in your mind when it comes to having a chronic disease, especially when you are an adult and you're in the field of like your study or just working. Like you can just give your own self anxiety because you had a pain episode and now you're just thinking 10 days in advance about how you're going to miss that one event, and you're going to miss a deadline, and you're going to do this, and then that kind of just feeds your chronic illness.
Yeah.
Like those negative thoughts feeds your chronic illness. So
And
I
love that you said that, Imani, like just about how it feeds your chronic illness, because it's almost like a cycle, right? Like when we talk about, the emotional and mental effects that it has on sickle cell, I feel like, to answer your question, Trinity, yes, I would 100% recommend anyone to get therapy.
Mhm.
But I think especially when you're transitioning to adulthood, and then especially when you have a chronic illness, because there have been moments for me where, sickle cell has caused my depression. And sickle cell was a great foundation of the depression. And it's like, I feel like when we talk about, childhood trauma, like it's very, very traumatic to be, 5 years old and having to be held down by the doctors and everyone so that they can get an IV in, but they can't, now I got triggered. But it's very traumatic, or not being able to walk or being in the hospital and that, as a child, I didn't get therapy. And so if you're not getting therapy as a child with chronic illness, that only adds up. And then, being isolated, well, that kind of can tell a person that they're least valuable, and things of that nature. So I think even tying it back to my adulthood and things of that nature, I've realized that stress is a really main trigger. And then that causes sickle cell. Then the sickle cell, then you get the trauma of being even in the hospital, which maybe we could talk about later. But how you're being treated by nurses and doctors and things of that nature, that's trauma. And then it's almost like, even when we talk about getting better, like the whole recovery process after being in the hospital for weeks, with your body withdrawing, like that's trauma within itself. And it's like, now it's my dog. But yeah, I'm going to let you take it off because my dog has a lot to say about that. So,
I definitely emotional support animals are very good as well. We would shout those out. Obviously, me and Ananda both.
I was about to tell Snow to chill out. But it definitely kind of like makes me reflect on like my own mental health, because I don't, like I said, I don't have like a physical chronic illness, but I do. And I've been open on this platform about like struggling with depression and anxiety. And I definitely kind of like understand like that cyclical part of it, because like I get anxious and then I get depressed about being anxious. And I feel like sometimes it is like debilitating, and it does kind of like affect your mental health. It's kind of weird to say, but like your mental health affects your mental health, because like when you're down and like you're feeling so down that you have to call out of work. Like I've called out of work plenty of times, and it's just like, dang, I really do need the money to be able to afford the lifestyle that I want, or even just not even being able to show up for yourself, like school wise. Like I just can't pull myself out of this bed to like do school. So I definitely understand like the effects of like just feeling kind of like it's a cycle that you feel kind of trapped in. Before we shake up the table, I do want to read some of the comments that we're getting. Christopher Henson says, "Good morning, everyone." He says this conversation needs to be had and promoted. At some point, he laughed. And then we have somebody from Qatar that is showing us love. So thank you. We're international over here. But I want to talk about experiences of discrimination, because knowing you, Imani, and the things that like we've talked about just from your interactions with doctors, and I imagine, Ananda, that you've experienced the same thing, especially given that you grew up in an area where sickle cell wasn't prominent. So I want to talk about, how does it feel to be a person of color with a disease that is prominent in the community of like colored people, receiving care from white doctors or care from doctors that are not within your culture? Let's talk about it.
The question triggered me, so I'm gonna let Ananda go first.
You let me go first? Yeah, I know I got a little triggered too, girl. Yeah, that is a very, very, that's probably one of the hardest things about having sickle cell, I think. Having to navigate being in a place where you're supposed to be getting help, and oftentimes it's like you have to fight to even get help, especially when you are in a position of complete vulnerability. Like when you are in a crisis and in such extensive pain, you are as helpless as a child, you know? And so to be vulnerable to people who don't really check their biases at the door is something that is very disheartening and traumatic within itself. I especially being growing up in Las Vegas. Las Vegas is, you know, on the West Coast, so it's not, like I said, there's not a lot of people who have sickle cell, and so I didn't really get to go to the camps and have those like outward resources of support other than, you know, my community, my family. But I remember that there was a time I was about maybe 19, 20 years old. I was in the hospital, and uh, you know, I had a doctor who wasn't Black, but also did not know much about sickle cell, who was helping me. And they do this thing where, you know, they want to like hit your back to see if it's like disaligned, or and then she wanted to do an X-ray to see if I had a broken bone. And I was like, no, like I know what this is. I grew up with this. And I think oftentimes in this case, especially, but we see it often, you know, doctors don't want to be told, you know, no, or I don't know. It's like they don't want you to tell them about, you know, a chronic illness that you deal with your entire life. Sometimes they're not open to it. And so she wasn't open to it. And she came to me, and because we don't wear sickle cell physically, well, we do, but when, you know, outwardly to everyone, we look normal. You know, she came to me and she was like, you know, I have patients in here that are sicker than you know? And I was like, and then she proceeded to take my fluid, like the IV fluid, and she threw it in the trash. I'm in the hospital. I haven't been checked out yet, but she took my IV fluid and she threw it in the trash right in front of me, and she walked out, you know? And so it's just like situations like that where, you know, I don't know, it's a very interesting dynamic between, you know, patients and doctors. But yeah, we could sit here all day and tell you all the stories, but I will let Imani go ahead and take it away.
I'm gonna keep it. I'm gonna keep it brief.
I mean, but feel free to like be as vulnerable as
outline.
you want, though.
Yeah. So I think with a chronic illness that is not as physically seen outwardly, as Ananda is saying. So I'm not maybe in a wheelchair. I don't have a cast on my leg. Like I do not have a deformity on like a limb or something that you can physically see. A lot of your pain also feels hidden. It also feels like you can only explain the pain, thus believability is hard for other people that do not have it. And so if I were to give grace to anybody in the medical field, it is simply that they will never truly understand what you go through because they do not have it. And thus, I get it being hard to treat something you will never understand unless you have it, right? On the flip side of that, I think that sometimes somebody telling you something in a field that you have done so much work and research and spent hours like studying and perfecting can feel a little like it can feel rude, right? But I think everybody who has sickle cell, you almost have like more than 10,000 hours of education because in that field of hematology, because it's literally your body. Like you know your sickle cell more than anybody else. So I think when you're going to the hospital and you already have that layer of being black, being a person of color in a predominantly white space where people already can dehumanize your pain, dehumanize your experience. You're already navigating that. Then on top of that, you're navigating being a woman. For me specifically, I know Ananda, which we all know the statistics on and the mortality rate of Black women in the healthcare field already. Like at the when it comes to births, when it comes to care in general, we already know how that goes. So being a woman and being like, are you really in pain? Or are you just being dramatic? Like, and then having a disease that is considered a rare disease to people who are white in the Black community, you're like, oh, this is prevalent in the Black community, but when you go look up sickle cell, it's considered a rare disease.
Yeah.
That there's not a lot of topics on it. Like I've had friends from med school as a biology major. Sickle cell is probably like a good 20 pages.
Yeah.
20 pages in a textbook. When I was a biology major, it was a good 1.5 pages. I will never forget. It is a good 1.5 pages in the curriculum at Spelman. No shade, no tea, Spelman. And I just personally think that experience emotionally when you're in such a place of vulnerability, because I think a lot of people with sickle cell, and I think anybody with like a chronic illness can relate, is that you let very little people see you in that state. Because you are still navigating it yourself emotionally, physically, and it's hard to let other people in to help you because you don't even know how to help you. So how are you going to let somebody in to help you? And so you go to the hospital seeking care, and someone takes it upon themselves to be like a judge or juror of what they think you deserve in terms of care is a very dehumanizing experience. And it almost makes you feel like you have to put on a performative front. Like I'm going there to prove to people that I am in pain rather than I'm going there to seek care. And a lot of the times I've had conversations with family and friends who they're on the phone with me and I'm in pain and they're like, Imani, just go to the hospital. And I'm like, I don't think I'm in that much pain to go to the hospital. And they're like, what? But you're in pain. And like, you sound like you're in pain. And you said you've been in pain for days. And I'm like, yeah, but if I'm not falling off the bed, they're going to look at me like, why are you here?
Yeah.
And that experience right there. And I'm glad Ananda didn't, she's so graceful that she wasn't dropping names. So I'm not going to do the same. That's why I'm so glad she went first, because I think as someone with sickle cell and talking to other sicklers, me and Ananda have had a lot of experiencing with volunteering and being out here in Georgia with different foundations, like speaking to other sicklers and stuff. And every person with sickle cell has had at least one experience where they went to the hospital and a doctor basically told them like, I don't believe you. You're not in pain. And then you kind of internalize other people's opinions. I think as people sometimes that even if you're as the most confident person is sometimes gonna feel like internalize other people's opinions if it feels like it's a lot of opinions. Like if it's majority people saying this, you start looking like, dang, am I in pain? Like, you know what I'm saying? You were at home on the floor crying, and then you get to the hospital and someone's like, are you really in pain? And the nurse is like, are you really in pain? And then you're like, dang, am I in pain? Like, and that experience right there, I think, triggers your own mental anxiety and depression. Like Ananda said earlier, it will then trigger an episode. Like now your sickle cell will trigger a depressive episode because you're like,
Michael.
am I really in pain? Am I? And it's just like this, like you said, cyclical experience of just kind of like that, like it's just a circle. And then that being said, not only physicians, not only these highly spoke of medical institutions, sometimes your favorite place to go get care for sickle cell, it'd be the worst place to go. And I'm gonna just put it right there. I'm not too much. I'm gonna just put it right there. It'd be the ones getting the awards on TV.
Okay, Imani.
But I said that to say that other than medical care, this also translates to people that don't know you that well. So people in the workplace can do the same thing to you. People in clubs, like in organizations that you volunteer in, can do the same thing to you. People in the classroom can do the same thing to you. So I'm going to stop there and, you know.
Well, I mean, I feel like you both like really just brought up like amazing points. And this was another statistic that I found that pretty much just supports like what you've been saying. People with sickle cell disease often experience poor body image, workplace, and healthcare discrimination as well, stigmatization, reduced quality of life. This is all from a research article based out of Baltimore. And it really just makes me think about and question the morality, the cultural competence, cultural humility of practitioners with patients that have a disease that is, or any chronic illness that is more prominent in one culture that is not of their own. So as somebody like me that is going into the field of social work, it's super important that people that provide services, clinical, just any type of service within like the human services field. It's really important for doctors to like understand like where patients are coming from when they feel like they're being judged. Like nobody should ever have that experience of having your IV bag thrown in the trash because you're not outwardly sick, or you're not throwing up with a burning high fever or whatever. You're not you're laying at home really contemplating whether or not if it's serious enough to go to the hospital, and you feel like no, because I have to put on a show, like you said, to prove that I'm sick, because practitioners in that culture don't understand what another culture is going through. So there's this book called Killing the Black Body, which I really like because it kind of brings into the historical context of the mistrust of doctors within the Black community because of the history of experimentations and things like that. We know the Tuskegee experiment. Dr. Sims, who was deemed like the father of gynecology, was actually performing like brutal experiences on Black women because it said that Black people can't feel pain. Like that was something that was ingrained into their heads. But it just makes you like really think about how like the field of like medicine and like learning about illnesses and disease and things like that transpire, and how so much of like sociocultural factors are left out of it because it's supposed to be like one body is the body, when in fact we go through different things because of the different cultures that we're from, the different races, ethnicities that we're from. Things are genetic based off of, or we are predisposed to different things based off of our genes. And my genes don't look like a white person's genes. So I don't know, like, I do, because we're coming up on time, I just want to share some of the other statistics that I found. So from the Center of Disease Control, just to bring it back to a general sense, patients with chronic illnesses such as diabetes, Parkinson's, and Alzheimer's suffer from depression. And I'm sure that there are sickle cell patients as well that suffer from depression, other mood disorders. And mood disorders potentially contribute to the mortality. So people even having a shorter lifespan, either from suicide, natural illnesses, things like that, contribute to the mortality of people with sickle cell disease. And that's also from the American Association of Hematology. So, in short, I kind of just wanted to ask about like your opinions of changes that you would like to be seen at the micro and macro levels within like the way that you receive care for your sickle cell, things that will kind of like improve your mental health. I don't know if that's a loaded question or not, but
I'll go. Um, so I think that despite some of the things, we have discussed, there are a lot of changes currently being implemented in the sickle cell community that I think are important to the lifestyle and overall improvement of quality of life for people that live with sickle cell disease. And a lot of them, like I have seen in Georgia, which is just important attention to transition. So transitioning from pediatric care to adult care is a really big topic in the sickle cell community. So more attention and funding going into transition from organizations, hospitals. Um, Even here in Georgia, they just started a sickle cell sanctuary. I'm not going to speak on it because I have not yet gone. But there are, mixed reviews about how some people feel like it is transformative versus others. But just stuff like that, spaces on a micro level, spaces that are catered to people living with sickle cell, topics catered towards people living with sickle cell, those I think are the macro level changes. The micro level changes, because there has not always been a safe space for sickle cell. A lot of hematology is just like clumped in with oncology. So a lot of sickle cell patients, for at least me growing up, have just been clumped in with like the people who are suffering with cancer, or living with cancer. And I think that also goes with like the research of doctors, because they went into the field of oncology and then just so happened to get maybe like a little bit of study, a little bit of rotation in hematology. So I think just on the micro level, having doctors who are more competent, who are more intentional about research in the sickle cell community, and then just those safe spaces and resources to be spread on a wider level for that. And then on the macro level, it looks like policy change.
Mhm.
Um, it looks like reevaluating the structure of hospitals. It looks like reevaluating the way in which an emergency room, something simple as that, is set up for people who deal with chronic illnesses and specifically sickle cell. And I think, if you are someone living with sickle cell, if you have someone that there's always a local movement going on with your political figures, your legislators, your chairman in that community that you can jump on, like that you can go and petition with. You can go to Capitol with an organization and you can write to your local congressman, like you can do that yourself. And I think those macro level changes in policy, and that's funny because like that's what I'm studying right now in my master's, is health policy and community health. And I think those changes will definitely affect not only sickle cell, but just in general chronic illnesses. So then I'll let Ananda take it away.
Yeah, so I'll go a little backwards here. I'll piggyback off of my Spelman sister here. Just when it comes, just in ingredients to, yeah, like the policy changes, obviously from more like legislative level. But I would say because I am more so like my steez is like the film and entertainment, I think it'd be really, really cool from a macro level to just get representation. Um, kind of see it a little bit with Supercell, which me and Imani have had conversations about, right? And no matter how far they go with representing sickle cell, just the idea that sickle cell is in conversation is, to me, I'm not going to say enough, but it's a start, because at the end of the day, the reason why, when growing up, we felt so alienated or isolated was because people didn't understand. And not just the people who are not of our culture, the people who are family members, our loved ones. Like people just don't understand. It's such a anomaly, or it's such a rare disease, quotation, right, in which people just aren't exposed to it. And so because of that, there is no support because people just don't know. And so when you are watching, Supercell or anything else in which there's representation of real people dealing with real issues such as sickle cell, you know it becomes a topic of conversation, of normal conversation, which then leads into the changes that we also see in the hospitals, and in, it becomes more important when it comes to policy. I'm a firm believer that, social media and like content and just society in general, we are the ones who dictate what's important and what's not important, and what's okay and what's not okay. So I think that we are, from that macro level, honestly, I'll bring a little optimism in here. I think that we are headed to a really good start. But in terms of more of a micro level, I would say that just giving people with sickle cell those spaces, yes, but also kind of like highlighting in those spaces, highlighting people who have sickle cell who are still living their lives, you know because I think that something like that humanizes people with sickle cell. I think oftentimes when we talk about sickle cell and we're in those spaces, right, we always talk about what needs to be talked about, right, but that often can lead to more of a negative impact, I feel like, at least on my mental health, when it comes to the things that come with sickle cell. But I think that it's really also important to just highlight that, hey, like, people are out here living their lives though, like, despite the trauma, despite the pain that sickle cell, does to a person and their families, there are people who live their lives, and some of them aren't with us anymore, and some of them still are. So yeah, that would be the micro and macro level changes that I would like to see.
I think it's also important, something important for me. I gave blood for the very first time this year on Juneteenth, which was actually, is it World Sickle Cell Awareness Day or national?
Yeah.
Okay. So I had never given blood before, but I did it with the American Red Cross, and they made my experience, like, beginning to end, like checking in and like checking out, was just amazing. It was super easy to sign up. They even tell you your blood type, like, obviously not on the spot, you have to wait till your blood gets processed and everything, but it was really just an eye-opening experience for me, and very special to be able to do that on that day, to acknowledge the ancestors, but also to like see what I can do for my community going forward. So I learned that my blood type is B positive, which American Red Cross also told me is needed within like the Black community, people with sickle cell disease. So they do have times where you're going to have to wait a certain period of time before you donate again. But now that I'm eligible to donate again, I actually am very excited to be able to go and donate more. I don't know, if you have a high pain tolerance, I still urge you to go. The needle's pretty big, but I mean, it's for a good cause. Like, I felt better knowing that I was a part of something that's so much bigger than me, and to be able to have connections with like the sickle cell community through Imani, through you, Ananda, and anybody else that we went to Spelman with, and whoever that this just reaches to, is just really important to me. So I feel like they definitely need to, or we need to educate our community members to get out there and to get tested, so you can even know if you're a trait carrier. And if you're not, you are a perfect candidate to donate blood, and you never know unless you get tested. So I definitely encourage anybody watching this to go out to your local American Red Cross anytime that they have a donation. Just see what it's about. Like, educate yourself first, and really just get involved with the process if you can. So we have, oh yeah, go ahead.
And just to add to that quick tip, I also would encourage anyone watching this to go and get tested. Especially if you're of, African descent, go and get tested as well, because that also, once when you can prevent. So yeah, go get tested for sickle cell trait, all of those things.
Yes, very important. Genetic testing all together.
Yeah.
Never hurts to know. You can be very preventative. We have one person in the comments. This person's very special to me. Her name is Lenore Bailey, and she is like my mentor. She was a social worker when I was in middle and high school, and now she's just been like a mentor, very positive role model in my life, in my journey into social work. So she says, thank you so much for sharing your stories. This is a very important topic. She asks, has the illness ever made you want to give up? If so, how did you deal with it?
That's a really good question. Wow. I can go. If I'm being so transparent, yes, especially, in my younger days, like just being a teenager and all, when you're in it, like there have definitely been moments where you just ask yourself why? Like why me? Like why me? But I feel like how I've been able to deal with those situations and those like really, dark and deep thoughts is just realizing and understanding that, and I know some people don't like to hear this, but I truly believe that I have sickle cell for a reason. I'm a firm believer in everything happens for a reason, divine timing, all of those things. And although it seems like I do believe that God will never give you anything that you cannot handle.
Mm-hmm.
I do believe that, a part of my purpose is to advocate for sickle cell because there's a lot of people with sickle cell who can't advocate for themselves.
Right.
So just being a voice for the voiceless is something that I'm very passionate about. And I think that is the thing that kind of motivates me to keep going in that way. And of course, my community as well has helped me deal with it a lot. So, yeah. Imani.
Oh, I feel like Ananda said it all, said it great. I was gonna take the next question, but I guess to touch on this one, yeah, everything that Ananda said, I have had times where the pain was just so unbearable. And you're in the hospital, you're crying, the medicine's not working, people are looking at you, you're the new guinea pig for some new medicine. And you kind of want to feel, you kind of like, since we're talking about Black mental health in that community, you feel just a lot of pressure, a lot of weight on you that it feels like you cannot bear. But as someone who like grew up in the Black church, Baptist church, like I definitely think that what keeps me going is my faith and the belief that, I was sent here for a purpose, for a reason. And a lot of that reason is to advocate and to show people with sickle cell that you can do it and you can get past it. And your experience with one episode isn't your life. Your crisis, your one crisis isn't the crisis that is your whole life. So
Yeah.
I definitely agree with what Ananda was saying. And I think that goes into her next question about the mortality rate amongst children and young adults. So the highest mortality rates for people with sickle cell is the ages of 18 to 25. So like that goes back to representation. Me and Ananda are both 25. So, and we're still here. So I think that's important right there. Just to show that like you can still do it, you can make it, and it gets hard. But even education, a lot of people don't know that people who actually do not go and get a college degree have a higher mortality with sickle cell than those who go and get a college degree. So, go out, educate yourselves, find your community, like you can do it. We've all been down, so.
Yeah. We have somebody from Uganda. Thank you for tuning in. Where I come from, the topic of sickle cells was sensitized to the mainstream public by the late, I don't want to butcher his name, I'm so sorry, who was an entrepreneur who found it as his purpose in his life to let Ugandans know about that very chronic disease. And that is where I learned about it. So And then Miss Bailey says, as someone with a chronic illness as well and diagnosed as an adult, I truly understand your journey. So I think I'm going to wrap it up here. I appreciate both of you so much for being transparent and talking about something that I know was not really easy to talk about. But it's important to bring awareness about it because we don't want anybody to feel like they're alone in the struggle, that there is a supportive community and people out there with the education or are invested in furthering education about sickle cell or any chronic disease that people go through, so that way it can be not only manageable, but you can also make the most out of life and not feel like you are being burdened with this disease. Rather, I like the way that Ananda said it, that you've been put here with this for a purpose, and that's to advocate for people that can't or that didn't have a disease, people that have passed away, that are bedridden in the hospital. So I really appreciate both of you for being here and talking about this today. And I'm excited to see, the progressions within the sickle cell community. I really am.
Me too.
Thank you for having us.
Thank you so much
for talking about it.
All right. Thank you.
Mhm.